David Hertel in for Elias. You might have heard of Ozempic as of late. Well, that's because it seems to be all the rage for weight loss. Although it was created to treat type 2 diabetes, Ozempic is increasingly being prescribed by doctors for weight loss. But while some nutritionists are not against such use of the drug, they nevertheless issue warnings for those who choose to use it. Dr. Melissa Vellucci, family doctor at Clinique Médicale La Croix in Laval, joins us now. Dr. Vellucci, thank you for joining us.
Hi, thank you so much for having me.
So tell me, first of all, I'm so happy that we're doing this segment because I keep seeing these commercials for Ozempic, and like most drugs on TV, you never know what it's for. they tell you about a drug, but you don't always understand what it's for. So tell me, what is Ozempic?
So Ozempic, like you said, was originally created to treat type 2 diabetes. It's basically a drug that's going to mimic a hormone in the body called glucagon, which is going to basically trigger an insulin release, which is going to lower your blood sugar. But at the same time, that same hormone really triggers a feeling of fullness. So it gets people to eat less.
And, okay, and that can lead directly to weight loss.
Exactly. They noticed in patients taking it for type 2 diabetes that indirectly it was causing weight loss. So the rationale and the public's logic, they said, hey, maybe we could take it only for weight loss.
And so is it currently being prescribed for weight loss?
So it is in very specific situations. So for patients with a BMI over 30, which means
BMI, sorry, doctor, BMI. Let's explain BMI.
Yes, body mass index,
okay.
sorry.
Okay,
so
no
with
problem.
A BMI, with a body mass index of over 30, which places them in the category of obese patients, it can be prescribed solely for weight loss. Also for patients who are mildly overweight, but with their weight problems causing other health issues, then it can also be recommended.
Okay, so it's only in very specific cases. So I guess just to go body mass index of over 30, you're talking about a person with severe weight problems.
Exactly,
okay.
Exactly.
Because just to give us an idea, what's a normal BMI?
A normal BMI is up to 24.9, so up to 25. So
if you're over 30...
It's obese.
It's very obese.
It's not just mildly chubby or mildly overweight.
I see. Okay. So it's basically okay to use this in extreme cases.
Exactly.
And always under prescription.
Exactly. And it's always prescribed with basically a good meal plan and an exercise program. It's also important to understand that Ozempic is never, ever prescribed alone because obesity is a chronic disease, so you need to treat it chronically with also lifestyle changes.
Okay, so what are the pros and cons associated with this type of use?
I like that you're asking this question because, like any medication, there's risk and benefit. So for sure, if you're a patient with diabetes, the benefit of treating your diabetes is going to outweigh those risks, right? So for that, there's not any questions to be asked. However, for somebody who's just a little overweight and really wants that quick fix to lose weight, there is some serious side effects that could happen. So pancreatitis or gallbladder disease, which basically would show with nausea, extreme vomiting, extreme diarrhea, sometimes even some cases have to go to the hospital due to dehydration. And in mice and studies, it's also been showed to basically increase thyroid cancers. So anybody with a personal history or family history of thyroid cancer, we would not prescribe that medication.
So this sounds, these side effects sound kind of serious, doctor.
They could be serious, like any medication.
Yeah.
So that's why there's always some reticence in the scientific community. If you need it and your health is, if your weight is so bad to a point that it's causing health problems, then sure, we might risk it. But if it's just an extra 10, 15 pounds, and you'd be safer just going to the gym and going to see a nutritionist, to be honest.
Okay, so what do you think, or has there been a lot of studies, a lot of literature, peer review research on the impacts of Ozempic when used for weight loss?
So there has been a lot of studies. The biggest problem in the scientific community is long-term studies. So for any kind of weight loss medication, the longest study we've had on the market is 4 years. So for anything taken orally or by injections for weight loss, we don't know if it's safe. We don't know if it's working well after 4 years. For Ozempic specifically, the longest study in the market has been for 68 weeks only, which is about a year and a half. So technically, it's never been studied for over that period of time to see if it's safe or not, which is another reason why a lot of doctors would rather wait a few years, see what the studies will show, and then maybe would prescribe it more easily.
Okay, so interesting. I mean, I have one texter that writes, "Hello, I've been on Ozempic since November 18th. November 18, sorry. I've lost 54 pounds, and my sugar went from 30 to 5, and I feel amazing." Well, okay, so is that normal? Is that type of drastic reduction in weight can happen with Ozempic?
So once again, each patient is unique.
Of course.
The response is variable for everyone. So some patients will have those miracle studies where it worked really well. However, I've had patients who went into the emergency because of severe dehydration due to nausea and vomiting. I've had patients who developed eye disease, which is another side effect of those medications. So it's important not to take those, case by case and just generalize them to the general population.
No, very true. Every case is different. What about instances where you stop Ozempic and the weight comes back automatically? Is that something that has been seen?
Yes, it's been seen and it's been studied also. Basically, as soon as you stop the medication, weight gain is to be expected. Like I said, because it hasn't been studied long term, technically, if you want to keep the weight off, you're supposed to take the medication long term, but we're not sure how that's going to go yet.
Mm-hmm. So with what we know now, Dr. Vellucci, is this something do you recommend it for patients? Is it something that should be recommended for patients for weight loss?
So, like I said, if your weight is heavy to a point where it's causing problems for your health, sure, it could be something recommended. Personally, in my practice, I never do it as a first-time treatment. I always send my patients to see a nutritionist. I always send them to see a certified personal trainer. And if after weeks of that, it really hasn't changed anything, then I could put them on that, always discussing with them the risks and side effects and see if they're willing to take that risk for their personal health.
So let's drill down on that. So let's say I don't qualify. I don't have a BMI over 30, but I am slightly overweight. I'm having trouble controlling my weight. Let's drill down. You talked about a nutritionist. You talked about exercise. I mean, what would be the different tools for an effective weight loss strategy?
To see what's the trigger behind the binge eating or stuff like that.
Interesting. So there's a mental health component to weight loss in certain cases.
Definitely. They're very closely linked.
Very closely linked. Okay. So this is a broader strategy. So there's no quick fixes. There's no magic pill. It's really a combination, as you said, of nutrition, exercise, and maybe also mental health therapy.
Exactly. It's just, unfortunately, it's a reflect of our society right now. We get everything at hand, everything so quick, so people think, oh, there's this new magic pill, and it's going to fix my weight problem, but that's really not it.
I see. All right. So in terms of this phenomena with Ozempic, I mean, is this growing by leaps and bounds? Is this an issue, or is this something that is just a passing fad, or do we have to be mindful of the use of doctors maybe not respecting the criteria that you set out?
I think, from my point of view, from what I've heard, doctors try to respect the criteria as much as possible. It's really, there's a buzz right now in Hollywood. Celebrities are talking about it. On TikTok, there's users, influencers recommending it. So most of the time, whether you're a doctor or nutritionist, patients come in asking for it. And we have to kind of fight with them not to prescribe it if they don't qualify.
Really? Wow.
Yeah.
Okay. Well, very interesting stuff, Dr. Vellucci. Thank you very much for your time this morning.
Thank you so much for having me.
Dr. Melissa Vellucci, family doctor at Clinique Médicale La Croix in Laval.